At Palmetto ENT, our patient is our pinnacle of treatment. Nasal obstruction means different things to different people, and one of the most important things I want to find out from the patient is, what do they mean by nasal obstruction?
Nasal obstruction is a condition where people just can't breathe through their nose real well. Some of the most common things we see in our practice leading to nasal obstruction are structural abnormalities in the nose. Sinus polyps, which can also cause difficulty with sense of smell and taste. But after a couple weeks, if patients are still suffering from nasal obstruction, then it's time to come in for an evaluation.
Nasal obstruction can be caused by many factors, and quite often it's not one of them alone. Living in the Southeast, we live in what's called the allergy belt. So many of our patients have environmental factors that are a leading cause for their nasal obstruction.
If we find that nasal obstruction is being caused by an inflammatory or a medical condition, majority of those cases are going to be managed with medications, whether it's topical nasal sprays, saline irrigations, or even sometimes steroids. Structural problems, though, are typically managed surgically.
Certainly the options for treatment are based upon what we find at physical exam and with ancillary tests such as x-rays or CT scans. There are many tools in our box to treat nasal obstruction. At Palmetto ENT, we have everything a person needs to treat their ear, nose, and throat problems.